You still getting a lot of sick people coming in? What's the status report from the boots on the ground or the Crocs on the ground perspective?
Yeah, the clinic kind of a sense of how the Costco is. It's really true. Every time that we feel something coming up, come down, and it's truly correlate with the Costco and positivity rate. And so far, I tell you, the last week or so, the 10 days, we see less sick people. And there's a decreased number of positive in the clinic setting. I'm not sure why the JIC don't report the clinic no more, but it's just public health data only. But yeah, in the clinic, on the clinic level, the number is going down slowly. Well, we are more comfortable now, but again, I just every patient I see, I just still take some time and talk and educate them, and ask them to be cautious during the holiday. So hopefully, I think most of our people are aware of that. So what we don't want to happen is that they celebrate Thanksgiving, but they will miss someone during Christmas. That's what we don't want to do. Yeah, think about it. No, you do not want to lose someone in your family during Christmas time. So, uh, take care of your loved one, and take caution during Thanksgiving.
Yeah, no, I asked about the JIC information regarding why is it that we were only seeing numbers for the swabs and the results for public health and not from like GRMC or GMH or the private clinics. And apparently, according to public health, their lab and the epidemiology offices are moving to the ITC building, and so that's why we don't see that specific data included. But I was told that the overall number of swabs and results supposedly includes the private clinics and GRMC. So, for example, today, last night's release, 670 samples. That's everybody. That's not just public health, and there were only 70 that returned positive. So.
Yeah, it's kind of important to break it down to where it's coming from, just because we have to have data to kind of educate people here where you're supposed to go. You're supposed to go to the emergency room, you're supposed to go to the clinic. So it's kind of important to know, for people to know. So to lump everything together, it's kind of hard to do. We're not a big island. And I don't think it's that hard to kind of separate them out, so that way where it's coming from.
Right.
But again, we encourage that people, if they have mild symptoms, to go to a clinic level to be seen on the tier 2 and tier 3 clinic. If they have shortness of breath or you can't breathe, and that's when they go to the emergency room. You don't want to burden the emergency room so much, because I know they packed to the rim already, and so does the clinic at certain day. Yeah, I mean, they need to report a little bit differently, and hopefully after the move on this Friday and Saturday, that the number breakdown will be more accurate, and also it kind of lets you know more detail on like the location and comorbidity of the patient. So like I say, they are moving, so yeah, I would let them have to Friday, but I think Friday and Saturday next week it should be better.
Yeah. That was one of the things that I had noticed in the JIC reports, that whatever happened to the breakdown, right, of all the different swabs and results from the individual locations. But yeah, that's basically what I was told. What else did you guys discuss during last night's PAG meeting?
There's a new testing platform coming out, the BIMAX antigen card. It's a rapid antigen card that you can take, have to result about 10-15 minutes to identify if you have the COVID-19 or not. And it passed out by the government, and the key here is that to have available for own clinic to use. So I highly encourage own clinic in Guam to contact public health and try to obtain the biomass antigen card for the use with in your clinic. So it's really kind of identify a sick, positive COVID patient as fast as possible, so that way they can do the isolation. It's at no cost to anyone for that card. So the only thing that they can use on symptomatic patient. So if any clinic have that card, if you come in have cough and cold, any symptom that might relate to COVID-19, that the clinic can use it, and it doesn't cost the patient anything. So any clinic can apply, and the public health will make the process smooth for you to obtain the antigen card for your clinic. So yeah, that's something new. This is coming, I think, the last few days. So again, the message to the clinic is contact public health, Dr. Ampulisky, and then and try to get those antigen card to your clinic. So that way, you don't have to swab the patient and wait for a day or two for the PCR test to come back.
Is this the 30,000 antigen test kits that Dr. Ann was referring to last week, Friday?
Yes, okay. It's pretty simple. It's just like the flu swab, it's a nasal pharyngeal swab still, and just like the flu swab, it is very simple to use, and again, it gives you a result in 10 to 15 minutes. So, but it can only be used for symptomatic patient only. I mean that if you have no symptom, you're not supposed to use it.
Mm-hmm. Okay. Did you guys talk about quarantine?
We talked about the quarantine a little bit, but still, the process of quarantine is it depend on how the rate of positivity in the state. If they continue to surge upward, and it's kind of be careful on try to cut down the quarantine. Also, we still have to wait for the home quarantine process to be ironed out by public health. If you're going to test out on day 6 from the home quarantine, you have to have a process to monitor, make sure the patient show up for the testing. So those things still in the planning stage. So hopefully, I don't know, the next few weeks, depend how the numbers show up after the Thanksgiving and the Christmas, they might relook at that process again.
Mm-hmm. What do you know about this Guam Respond monitoring system that was released in the JIC last night? This new tool.
Yeah, the new tool is, I think it's just basically to monitor patient symptom somewhat, but I tell you, what we really need to do is have an overall system that starting from the testing process and make it smooth, so that way, digitally you can notify the patient through the SMS to their cell phone or to the email before the real person calling the patient. That's the timeline that make a huge difference when you have a positive in your lab to the time when the patient receive a call from an actual person. That is not happening. And it really need to be happen, because if I assume the lab come back positive, if the patient know right away to their phone, they would take precaution and isolate themselves away from their family. But if we're gonna wait till the next day or a day or two before we contact the patient, then it's too late already. Patients still go around and they're gonna give it to their family or to their friends already. So that's the testing part, and we haven't get there yet. And I'm not sure if public health have the ability to do that with the new digital platform they have. And also for isolation, I don't think that it's digitalized to the point where they are positive will go straight to an assigned person that will do isolation and make the contact right away. And then again, the platform need to carry over to, the contact tracing surveillance team. Those have to be in place, but I don't think that the platform they have is the right one that that do all that kind of stuff. And also, the platform is important because it gives you a key performance indicator. It lets you know how well you do, how well your isolation, how well the contact tracing, the surveillance. Are you reaching on time? So those are the main thing that we need to know in order to us to move forward. I mean, we are 8-9 months inside, and we still don't have the key performance indicator yet, and that's something that is hard to improve your process when you don't have those numbers. And as a physician advisory group, we are pushing for that number because we are anywhere close to have immunization or treatment for this, and it can take several months to another year or so. But we have to have those key performance indicator in order to know how well we do, and we're still waiting. So I'm hoping that with the moving and everything that public health have in the last few days, that I can provide that, so that way we can plan our future and make sure that what we do is correct.
I just wondering, maybe you could provide some clarification. When the governor met with the Rotarians yesterday, she had said that we were in the third wave of this pandemic. Is that the case, or are we still in the second?
I think we're going to be in a third wave or not. It really depend on the Thanksgiving and Christmas holiday. We are trending downward. Again, if you remove the cluster, we are trending downward slowly. But the holiday is around the corner next week. So yeah, that third wave might come if the people don't take precaution on next Thursday.
Right. All right. Anything else from the meeting?
Yeah, we just
vaccine, COVID clinic.
Yeah, the vaccine. I know they have a meeting this afternoon sometime just to go over the vaccine, the plan, and who will get it, and all that kind of stuff. So I don't have anything there. But
wait, who's meeting? Who's meeting?
There's a new treatment that actually the monoclonal antibody treatment that we just received, and it's supposed to give it to the mild moderate COVID symptom for COVID patient that can give to them right away, and hopefully it make them feel better. Just like President Trump had. So we try to roll that out as soon as possible. So as soon as you diagnose someone that COVID positive, and that they have comorbidity, that they can have the IV treatment right away, and hopefully they cut the risk of them end up in the hospital.
What was the name? What was the name of that?
Hope it worked, huh?
What was the name of that treatment?
Oh my goodness! I know you're going to ask that. It's a very complicated name. It's I think Bemivimab. It's a very, very long name. So
yeah, okay, but this is like through an IV.
It's through an IV infusion. Yeah, it's only give once, one time. So it's only give one time only, and it's supposed to kind of block the virus into entering the human cell. So basically, it neutralizes the virus, and hopefully it works and make people feel better faster. But again, we have a few doses. I think 50, 60 doses, and if we use more, they give us more. But it's interesting, and to see how it will cut down the hospitalization of the patient, especially one that have high comorbidity. People ask what comorbidity, and comorbidity is number one is obesity, which is the weight. Diabetes is the other one. Hypertension,
Doc,
heart disease,
it's
smoking.
Bamlanivimab.
Yeah, yes, there you go. You
right
can
on.
get that one.
Just refer to me as Dr. Barnett from now on. Yes, I have your prescription of Bamlanivimab.
This is the one that
it's a
Lillian was
tongue-twisting
talking about,
word.
right?
Dr. Cabrera just sent it to me. It's
Oh.
Bamlanivimab.
Yeah.
Bamlanivimab. Bamlanivimab.
Okay, got it.
Yeah,
Got it. Okay.
But-
Bamlanivimab.
If you use that in
Bibimbap.
Scrabble, you are the
It just
trash
reminds me
champion.
of what's that Korean dish in the
I
hot
know.
pot? The bibimbap.
Bimbop. Bimbop.
Put that in my IV.
It's nice to have, and I think that GRMC set up that tent and the IV infusion chair already. So, the process will be kind of ironed out the next day or two, and we hope to start the treatment so that way, again, the patient feel better and recover without having to go in the hospital.
But there's only 50?
Yeah, but I think after you use it, they give you more. It depends on how much you use
And
it. So
this is
we have-
from HHS?
yeah,
Okay.
this is it's not going to cost the patient anything.
Can you say that one more time?
Chris, go ahead, Chris.
Bamlanivimab. Yeah, it does. Glenn on our Facebook Live said it sounds like bibimbap.
Okay.
It reminds me of that.
Anyway, but-
Remember that song, Jay?
but-
Bop,
Bitty bitty bop.
bop,
Oh, I thought that
bop.
other one, that bitty bitty bop.
Oh yeah, the Ika Mouse.
Yeah.
Hanson, right? Yeah.
Like, really, if you can, just pass the message. Ask people to really take precaution during Thanksgiving, and hopefully, we don't have the third surge that that we expected, and we can have nicer Christmas, and we won't lose anyone for Christmas. So, please take care of your elderly, and be safe and happy Thanksgiving.
Okay.
Doc, are we going to talk to you before Thanksgiving, or is this goodbye?
No, you
Yeah.
can
Okay.
always call. It's
yeah.
okay.
Okay. Just checking because you made it sound like yep. Checking out, guys. Are you going to be on island, or are you going? Where are you going for Thanksgiving? Saipan?
No. I'm gonna be working, so it's gonna be okay.
Right. Us
All
too.
right.
Okay, Doc. God bless you.
Don't leave us, Doc.
And if you get a
Okay,
line on some of
thank
that
you, guys.
bibimbap,
All right,
Already-
take,
Okay.
already
Be
forgot.
stay
safe,
safe.
Okay. Okay. Bye.
Okay, Doc. Thank you, Dr. Hoa Wen of the Physicians Advisory Group. Quick break. Coming back with Dr. Ann Pobutsky, the territorial epidemiologist.